Hello, my name is Michelle. I'm a student with Indiana State University in the Bachelor's of Science in Nursing program. Today I'll be discussing sudden unexpected infant death. SUID, or sudden unexpected infant death, is the death of an infant under the age of 1 year of age where the cause is unknown despite having investigated every aspect. It often occurs during the sleep in the infant sleep area. It is the second leading cause of deaths in infants in the United States. There is, however, an initiative to help educate parents and potential parents about the risks in an effort to reduce the factors that can be modified that lead to sudden unexpected infant death. The learning objectives for this video are that by the end of this presentation, the viewer will be able to identify recommended measures to have in place to reduce the risk of SUID, name the prenatal risks for increased risk of SUID, identify the most common types of SUID, and name the ideal sleeping environment for an infant under the age of 1. At this time, I would recommend that you pause the recording and take a brief test to check your knowledge base and see what you stand to gain from this presentation. Now, the types of sudden unexpected infant death are multiple, but they come down to the sudden infant death syndrome, accidental suffocation in the sleeping environment from multiple causes, and other deaths of unknown causes. In this picture, you can see that there are certain metabolic disorders, hypothermia or hyperthermia, neglect or homicide, accidental suffocation, poisoning, downright unknown, and SIDS. Now, when it comes to the health of the mother in the presence of pregnancy, it is important to take into consideration that the overall health of the mother greatly affects the health of the unborn baby, meaning that nicotine use should be avoided in pregnancy as it can cross the placenta into the bloodstream and cause restricted lung growth, overall restricted fetal growth from the nicotine constricting blood vessels and nutrients from getting to the baby. Alcohol and drugs have similar effects, though there can be brain retardation and overall withdrawal upon birth. So this also contributes to the risk of sudden unexpected infant death after they're born. It's also important to get the prenatal screenings that are recommended, including blood work and making sure that you're up to date on your vaccines. Having a healthy diet, including rich in folate, to help prevent neural tube disorders also helps contribute to the overall benefit to the baby upon birth. Now, the ABCs of safe sleep include that they sleep alone, meaning nothing in the bed with them. It's one thing to have them sleep in the room with you, but it's another to have them sleep in the bed with you. There's risks of rolling over onto the baby's face getting stuck up under the body of the parent, the pillow, blankets, and having suffocation occur accidentally through that. They don't recommend any toys or pets or siblings in the bed because of the same problem. They also should be placed on their back to sleep, not their side or the tummy until they're over a year of age. Now, if they get to a stage where they can roll themselves over onto their stomach as they get closer to a year of age, it's not a rule that you need to flip them back over onto their back. That's fine. That means that they have that protective capacity to clear their face, but they should always start off on their back. If parents are worried about a flat head, this is not that concerning, and most pediatricians will tell you that the skull isn't completely solid until almost 2 years of age anyway, and it can be corrected. As for the crib, the C of the ABCs, they need to be placed to sleep on a firm, flat mattress. The bars between the cribs, or of the crib, should be no more than 2 3/8 inches apart so that they don't get an arm or their head trapped between the bars. And then avoid blankets. I know a lot of parents are concerned about baby being too cold while they sleep, and in that case they recommend a sleep sack with no drawstrings. Once they get a little bit older, it's a different thing to include blankets where they are fully capable of keeping their face clear while they sleep. Babies have a tendency to squirm a lot in their sleep, and they just don't have the ability to move things away from their face should they get trapped. They also don't recommend using crib bumpers for the same reason, where they could get it stuck against their face and not be able to clear their airway. The other potential causes of sudden infant death, unexpected infant death, include choking and suffocation hazards. This includes keeping objects away from babies that have buttons, loose threads, beads, anything that they could potentially pull off of a toy and get in their mouth, nose, or airway. As anyone who has a baby, they know that whatever they can get in their hands invariably ends up in their mouths. So that goes for like marbles, small balls, coins. When it comes to mealtime, make sure that foods are soft, chopped up small, and they're easy for the baby to chew. No plastic bags or balloons, because those can easily obstruct the airway. When you have curtain cords or mini blinds, you want to make sure the cords or the wraps are out of reach so that they can't get themselves entrapped and end up with accidental strangulation. You want to make sure clothing is secure and no drawstrings, nothing too baggy where they could get trapped in their shirt or jacket, hood, what have you. Bedding needs to be well fitted. Avoid crib bumpers and blankets, as I previously said. Now, there's some myths and facts when it comes to getting babies to sleep on their back to avoid sudden unexpected infant death. So the first myth is that babies who spit up or vomit while they're sleeping on their back will choke. Well, babies are born with a reflex that helps keep their airway clear in this regard. So that's not so much of a problem. Most babies sleep with their head turned to one side, even if they are on their back. Another myth is SIDS can be prevented. Well, SIDS is the sudden infant death syndrome, the one that we don't necessarily know the cause of. We can't foretell that it's going to happen. It just happens, sudden, hence the name sudden. The fact is that there is no way to prevent it. There are ways to reduce the risk. Parents should not be shamed if their baby succumbs to SIDS. There are a lot of support groups to help educate them and support them during that grief time. SIDS can occur in babies of any age. That's not fact. Babies are only at risk for SIDS until 1 year. There are some additional educational resources for those who are interested. It also includes a link for the American Heart Association for people to gain access to learning how to do infant and child CPR. It's highly recommended that parents and potential older siblings learn how to do infant CPR, because this can greatly diminish the amount of anxiety should they come across their child in a situation where they're struggling to breathe or have choked, or they find them not breathing in their beds. All of the recommendations originate with the American Academy of Pediatrics, and they update them periodically as new research comes to pass. These are my resources for all of the information provided in this presentation, and I hope that you learned plenty about how to prevent sudden unexpected infant death in this presentation.